Hi there, this is Mark Ittleman, speech-language pathologist, and this particular video is about personal autonomy and aphasia. Now, that's a pretty big word, personal autonomy, and basically it means that we all as persons have the ability to determine our future. Now, it may not be that way in every country, but here in the United States, it is. We have the ability to pursue almost any interest that we would care to. And that's one of the beautiful things about our country. And one of the things that I'd just like to speak to you about is personal autonomy when it comes to aphasia. You know, people with aphasia and their caregivers are so dependent on healthcare providers. They're dependent on physical therapists, occupational therapists. They're dependent on speech pathologists, neurologists, orthopedic specialists. Just so many different areas that they are very dependent on. And there are times when these resources are not really available to us. They may be available to us initially, but then after a while they may not be available because of various insurance caps or things like that. So we all know too that with a problem such as aphasia, it's not something where there's a quick fix. So those with aphasia and their families are dependent upon these resources, these therapies, to continue to provide treatment for the various needs of those with aphasia. Now, I wrote a book a while ago. I've been working in a hospital setting with those with aphasia for many, many, many years. And when I decided to leave hospital work, I thought it would be a good idea to write a book for those with aphasia because of the fact that I can't tell you how many times I'd be working with somebody and then I'd get a slip from the administration letting me know that I had to discontinue a patient. Now, it wasn't because necessarily the patient had plateaued. It was because the administration was concerned about whether or not Medicare would continue paying or whether or not an insurance company would continue to pay. So quite often the hospital did not want the liability of paying for continued care when they were not sure if the healthcare provider or the insurance or whomever was in charge of paying for the services. They just didn't want the risk of being left holding the bag, so to speak. And so I'd be working with a patient, and the patient would be doing really well, and all of a sudden they'd come to me and say, "Mark, you gotta discontinue this patient." And you know something? I had to tell a lot of people that. And you know what happened? I'd see them crying. I would see them upset. I would see them flabbergasted because all of a sudden their support system that I had to say to them that I could no longer be their support system. I could no longer provide them with therapy. I could no longer provide them with the training that they needed to help their loved ones speak better. So this is Mark Ittleman, speech-language pathologist. It would behoove anyone who's a caregiver, especially in these days and times, to make sure that you are not left holding the bag, so to speak. What I would recommend to anyone is that you do as much research to find the methods that you could use at home in case that time comes. Because you know something, we always have to be prepared. There are hurricanes, and many of us have hurricane kits in our homes. Many of us have different medicines to take in the event that we get some type of illness. These are preventative things. And in these days and times, with those who have aphasia, we need to have a stash of preventative products that we have available to us to deal with these kinds of emergencies, to deal with these kinds of circumstances that occur. So what I'm suggesting to you is that if you have a concern about how long your speech therapy is going to last, that you consider learning the teaching of talking. The teaching of talking is a great method, and it's been a method that's been around for quite a while. I developed it, and it helps people talk better. And it trains caregivers or wives or family members how to help their loved ones speak. Now, currently, I have a number of wonderful care people who are helping their loved ones speak. I work with a couple of different wives of gentlemen with aphasia. And I just started with another gentleman who has a daughter who's helping him speak. And they're learning the teaching of talking method. And when I watch them do therapy, it's like I'm watching experts do speech and language stimulation with their person with aphasia. So I'm just putting it out there that you want to make sure that you have some personal autonomy, that you have the ability to adjust and to provide a necessary care if the regular professional care is not provided to you anymore. And this will be the key to your loved one's continued improvement in the area of speech and language, or in terms of any area that that person may need. It would behoove you to learn as much as you possibly can to help them in the event that therapy gets terminated or discontinued. This is Mark Edelman, speech-language pathologist. If you'd like some more information about the teaching of talking, you can go to the Teaching of Talking website. And on the website, which there are links below this video, you can click on weekly blogs and videos that we can send you, or you can click on our Facebook page, or you can click on a questionnaire. So if you're interested in learning or having me mentor you in how to help your loved one speak better, there are lots of links below. And just know that, there's a lot of material out there that's free. But you need to know, if you have a loved one with aphasia, you need to know what exactly you have to address. And all this free stuff is great. It's very general, but it doesn't necessarily deal and teach you how to help your loved one speak better, because there's no one-size-fits-all. There's no free tablet or free software or anything free like that can deal with a complex type of speaking difficulty like aphasia. And for a person with a complex aphasia, to really get better, you've got to learn as much as you can about the parameters of speaking and how to improve those things. So this is Mark Idelman, speech language pathologist. If you've liked this video, please give us a thumbs up, and please don't forget down below to click on our website and click on for getting more videos and the questionnaire. If you'd like to speak with me personally at no charge, I can help you, I can advise you, and I'd like to thank you. Thank you for stopping by today, and I hope that we'll speak again in the future. Bye-bye now.